Do you know what to do if someone near you suffers a heart attack? It's a question that carries more weight than you might think. Heart attacks are an unpredictable menace, not partial to time or place. They can strike anyone, anywhere, at any time. Whether you're at home, in the office, or out and about, the threat of this silent killer is ever present. No one is immune. Men, women, the young, the old, the fit, the not so fit. And that's what makes this topic so important. It's not just about you. It's about your spouse, your parents, your children, your friends, your colleagues. Imagine being in a situation where a loved one or a stranger suddenly clutches their chest and collapses. Would you know what to do? Your actions in that crucial moment can make all the difference. Because when it comes to a heart attack, knowing how to respond could mean the difference between life and death. Scene script. First, it's crucial to recognize the signs of a heart attack. Now let's dive into the common symptoms that signal a heart attack. The most prevalent symptom is chest pain. This pain can be severe or mild, and it's often described as a feeling of tightness, pressure, or a squeezing sensation in the chest. But remember, it's not always dramatic or intense. Sometimes it's just an uncomfortable sensation that's easy to dismiss. Next, shortness of breath. This can occur with or without chest pain. It's a feeling of being winded, as though you've just run a marathon, even if you're sitting still. It's your body's way of saying it's not getting enough oxygen. Now let's move on to discomfort in the upper body. This can show up in various ways. For some, it's a pain that radiates to the arms, neck, jaw, or back. Others may feel a gnawing ache in the stomach or a sensation that's often mistaken for heartburn. One important thing to note is that symptoms can vary significantly, depending on age and gender. For instance, while men are more likely to experience chest pain, women often have symptoms that are less recognizable, such as fatigue, nausea, or lightheadedness. Older individuals may experience more subtle symptoms like fainting spells or a sudden onset of extreme weakness. So why is it important to know these signs? Well, heart attacks don't always strike with a dramatic collapse and a clutching of the chest like we see in movies. They can begin slowly, with mild pain and discomfort. By recognizing these symptoms early, you can seek medical help promptly, which can make a significant difference in treatment outcomes. Remember, not all these symptoms occur in every heart attack, and sometimes they go away and return. So don't wait for all symptoms to appear. If you're experiencing some of these signs and they're unusual for you, seek medical help right away. Recognizing these signs could save a life. Once you've identified the signs, it's time to act fast. Your immediate response can make a significant difference in the outcome. The first step is to dial your local emergency number. In many places, that's 911. While you wait for help, try to keep the person calm. Panic can exacerbate the situation, so reassure them that help is on the way. If the person is conscious, help them into the most comfortable position. Usually this is sitting down, slightly reclined. Next, check if they have any prescribed medication for heart conditions, like nitroglycerin. If they do, assist them in taking it. If they become unconscious, however, it's crucial to start cardiopulmonary resuscitation, or CPR. Remember, even if you're not formally trained in CPR, doing something is better than doing nothing. Push hard and fast in the center of their chest to the beat of a fast-paced song like Stayin' Alive. Every second counts in a heart attack situation. Opening. If the person becomes unresponsive, you may need to perform CPR. Cardiopulmonary resuscitation, better known as CPR, is a life-saving technique that's absolutely crucial in emergencies like a heart attack or cardiac arrest. It's vital to start CPR as quickly as possible if the person is unresponsive and not breathing normally. So, how do you perform CPR? It's a two-part process involving chest compressions and rescue breaths. But before you start, make sure to call for emergency help. Shout for someone nearby to call for an ambulance, or if you're alone, put your phone on speaker mode and dial it yourself. Let's start with the chest compressions. Kneel beside the person on the floor. Place the heel of one hand in the center of the person's chest. Place your other hand on top of the first, then interlock your fingers. Now, using your body weight, press straight down by 2 inches, then let the chest return to its normal position. Aim to do these compressions at a rate of 100 to 120 per minute. That's about 2 compressions per second. Now, let's move on to rescue breaths. After 30 compressions, give 2 rescue breaths. To do this, first, tilt the person's head gently to lift the chin and open the airway. Pinch their nose shut, take a normal breath, and cover their mouth with yours, making a seal. Blow in until you see their chest rise. Remove your mouth, watch the chest fall, then repeat this once more. Then, go back to the chest compressions. Continue the cycle of 30 compressions and 2 breaths until help arrives, the person starts breathing normally, or you become exhausted. Remember, CPR can be physically demanding, so if there's someone else available, take turns. It's worth noting that even if you're not confident, any attempt at CPR is better than none. Your actions can only help. Closing, CPR can keep blood flowing to the brain until help arrives. While it's important to know how to respond to a heart attack, prevention is key. The path to a healthy heart isn't paved with grand gestures, but rather a series of small, manageable steps that accumulate over time. First and foremost, a balanced diet is crucial. Think of your body as a high-performance vehicle. It requires the right kind of fuel to run efficiently. Consuming a variety of fruits, vegetables, lean proteins, and whole grains can do wonders for your heart. Next, regular exercise helps to keep your heart strong and resilient. Even moderate activities like brisk walking, cycling, or swimming for just 30 minutes a day can significantly reduce your risk of heart disease. Lastly, routine checkups are your first line of defense against heart conditions. Regular visits to your doctor can help detect issues early, before they escalate into major problems. Remember, your actions can make a difference when it comes to heart health.